Hello, my name is Alyssa Brenner, and this is my presentation for the paper I'll be writing for Ethical Practice and Policy for Unity College in Maine, December of 2020. My focus is going to be on environmental justice and COVID-19 and the environmental inequality in a pandemic that affects minorities and people of color at a much higher rate than whites and non-Hispanics. First, I want to start by defining environmental justice as the EPA defines it. Environmental justice is the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. The goal for environmental justice is to achieve basically the same degree of protection from environmental and health hazards and have equal access to the decision-making process that provide healthy environment in which to live, learn, and work. In a nutshell, it comes down to equality of exposure. Fair treatment under environmental justice is defined as no group of people should bear a disproportionate share of negative environmental consequences. These consequences can result from industrial, governmental, and commercial operations or policies, and meaningful involvement ultimately means that people have an opportunity to participate in these decisions regardless of their race, national origin, socioeconomic status, etc. Where does environmental justice come into play with COVID-19? COVID-19 is a worldwide pandemic that struck in spring of 2020. COVID-19 is a highly infectious respiratory disease, and it's fatal in approximately 2% of those infected. We're going to focus on the United States for my paper, and in the United States, there's been over 14 million cases of COVID-19 as of December 5th, 2020. Of those over 14 million cases, 275,000, upwards of 275,000 fatalities have occurred in the United States from COVID-19. COVID-19 is spread primarily through respiratory droplets and human-to-human contact. It can also survive on surfaces and various fabrics. Unequal exposure to COVID-19 is where environmental injustice comes in. As you can see in the table here on the screen, American Indians, Alaska Natives, non-Hispanic persons, Asian and non-Hispanic persons, Black or African Americans, non-Hispanic persons, and Latino persons are infected, hospitalized, and die from COVID-19 at a much higher rate as compared to non-Hispanic persons or people who are white. These exposure, hospitalization, and death rates range anywhere from 0.6 times higher all the way up to 4.1 times higher hospitalization rate for Latino persons as compared to white people in the United States. Some reasons for unequal exposure. First off, there has been no biological evidence that there's a difference in race on the impact of coronavirus. So the difference in case number, hospitalizations, and death comes down to socioeconomic status and the fact that minorities make up the lower income portion of the United States at a much higher rate than white Americans. Some reasons for unequal exposure to COVID-19 that have been identified in the research. Low income and low socioeconomic status leads to higher health risks due to environmental factors. This is where environmental justice comes in. Long-term exposure to air and water pollution ultimately decreases health over time. A Harvard study shows that exposure to fine particulates in air pollution is associated with a much higher death rate for patients who are infected with COVID-19. In low income and low socioeconomic areas that are ultimately mostly minority areas, there's also less access to healthcare and healthy food. There's also lower education exposure. So long-term health issues that plague our neighborhoods in the United States that are made up of mainly racial minorities ultimately make these individuals more susceptible to negative impacts of COVID-19 and similar pandemics that may affect us in the future. Another reason for unequal exposure is crowded urban housing. Minority neighborhoods and neighborhoods of low income are often situated in urban areas, apartment complexes, and areas where we're not able to spread out. Another reason for unequal exposure is that low-income employment and jobs have been deemed essential during the pandemic. This can range anywhere from nurses to restaurant workers, gig workers. Oftentimes these workers are living paycheck to paycheck, and they do not have the opportunity to work from home as do middle class and upper class, more corporate-based employers. In addition, lack of exposure and information as well as warnings and public health orders, have been cited as a reason that minority and racial minority groups do not get as much information as quickly. It also comes into play with a language barrier. There's been a huge push to transfer warnings and COVID-19 information into different languages so that immigrants in the United States can be more readily exposed to this information that can help protect their health. 2 case studies I want to focus on. Case study number 1 was published in the New York Times, and it's titled "The Fullest Look Yet at Racial Inequity of Coronavirus." In summary, it gives statistics on racial minorities being affected at a much higher rate than white Americans to coronavirus. Latino and African American residents of the United States are 3 times more likely to be infected than their white neighborhoods, and with higher infection rates comes higher death rates. Case study number 2 focuses on Native Americans. Native American populations in the United States have had similarly a much higher infection, hospitalization, and death rate per capita to COVID-19 than white Americans. Native American tribes fund public services through enterprises such as casinos and contracts with the government, and these ultimately provide funding for their healthcare, their police, their public service entities. Native Americans do not fund these services with taxes. So as compared to Americans who are white, there's no tax base to fund these things. In April of 2020, the Navajo Nation was the 3rd highest per capita infection rate in the country. Ethical ramifications. You can see in the graph on the page here that poverty affects people differently based on their ethnicity. 25% of Native Americans are impoverished, 20.8% of Black Americans are impoverished, 17.6% of Hispanic Americans are impoverished, as compared to white and Asian Americans who are 10% under the poverty line. Unequal exposure to life-threatening illnesses based on race and socioeconomic systemic racism is the definition of environmental injustice and has been magnified during the pandemic of COVID-19. Some policies that have come to address these issues. The CARES Act was released by the government. This was a $1 trillion stimulus package, and ultimately Native American tribes will receive $8 billion in relief. In my paper, I focus on some issues that arise between the different tribes, specifically Alaska Native corporations, and how tribes in the continental United States do not believe Alaska Native corporations that work for profit should receive as many benefits. More policies for funding that have been provided by the government was the Families First Coronavirus Response Act, stimulus checks, payroll tax breaks, student loan freezes. There's been a boost in unemployment benefits. The focus of this is that these policies have mainly failed to address those who are most in need, which are low-income, service industry, and gig workers. Often these stimulus policies help big business and smaller business with their employees, but it doesn't help the employee themselves long-term. As I just mentioned, effectiveness of policies basically is limited to the acute pumping of money into systems. It provides acute relief but not long-term stability for systemic racism, classism, and environmental injustice that will continue to negatively impact people of color and people of low economic status that are associated with racial minority groups in the future. A quote by Human Rights Watch senior poverty and inequality researcher Lena Semmett summarizes this well. The U.S. government needs a response to the coronavirus that prevents people from having to choose between a missed paycheck and risking their and their families' health. We need an ethical approach to solving the issue of coronavirus and environmental justice, where they come to a crossroads. We need rights-based ethics to come into play, where equal rights, opportunity, regard, and well-being are attributed to all citizens, regardless of race, socioeconomic status. Ethics of care is another big one, and nurses have been a main focus through the coronavirus as leaders in care. We need a strong approach based in empathy and interpersonal relationships that has a moral sentiment. In addition, virtue theories touch on this as well, and we need a base of morality to see the humanity for the reasons we need to more equally address COVID and coronavirus issues and address the issue that minorities and racial minorities are being affected at a much higher rate when it comes to life and death situations. For an ethical shift, we need to look at capitalism versus socialism, human and health and well-being as an indicator of success versus economics and health of the stock market. We need to push for environmental justice initiatives for long-term goals with a steady stream of dependent funding, not just short-term fixes. Thank you for listening to my presentation. Here are a list of my resources. And ultimately, in conclusion, my paper will cover the issue of environmental injustice, which more heavily negatively impacts racial minorities and lower socioeconomic groups in the United States when it comes to health issues such as coronavirus and future pandemics.